Are you suffering from lower back pain after lifting and you're wondering what you should do? This video is perfect. That's exactly what I'm going to talk about. My name is Dr. Molly, and I'm with Your Goals Physical Therapy. Tom came to me after several months, like 6 months worth of dealing with lower back pain after he was at the gym and he went down for a squat, and as he was coming up, his lower back just grabbed him and wouldn't let go. He was able to re-rack his weights and sit for a little bit. The pain kind of subsided, but it stayed with him for a very long time. So long that he was afraid to lift, and his back would ache while he sat for too long. If he transitioned from sitting in his car to standing, if he sat for too long sitting on his couch, this nagging pain just persisted. And it was such that he wasn't even going to try to lift because obviously something was wrong. After 2 or 3 weeks, he went to his doctor. His doctor did some x-rays and told him there was nothing wrong. Well, that actually frustrated Tom even more because he's like, there's pain. There's obviously something wrong. And so he wasn't too thrilled with that. And again, this sort of persisted for a very long time. And so after taking the muscle relaxers the doctor gave him, resting like the doctor gave him, he was still very frustrated that he wasn't able to get back to lifting. So during our first meeting, it was very apparent that Tom looked at being able to lift weights and go to the gym as not only his time away to like decompress from his job and his family, but also a huge sign of his health and being able to stay young and do the things that he wanted to do. He saw this as the way that you stay on track and that you stay healthy. And so not being able to go to the gym was affecting him in a lot of ways. He really was nervous that he wasn't going to be able to go back to lifting the way that he liked to lift. And he wasn't really interested in lifting lighter weights, which is one of the things the doctor told him. And the last thing that he was again, I will reiterate how frustrated he really was when the doctor told him there was nothing wrong with his back, knowing that he was uncomfortable and having some pain. So I started by going over the anatomy of his lower back, and then I talked to him about very specific things he could do at home, which I will share with you to help calm down his pain. And I know that lots of people have tried physical therapy, and when they're trying to get back to lifting, there always seems to be a disconnect. They get out of pain while they're in therapy, but they might not be able to lift the way that they want. So I'm going to talk a little bit about that later on in the video also. So the anatomy of your lower back. Your lower back is made up of 5 bones that have then cushions between them that help you with shock absorption. You have ligaments that surround that, making a very good scaffolding. Also, the way, if you've ever looked at a spine, the way that the spine is designed, it has a specific intent to keep your spinal cord very, very safe. There's a lot of bony prominences, there's lots of ligaments everywhere. And everybody thinks that your low back muscles are the things that keep you stable. And ultimately, all your low back muscles are designed to do is keep your spine in its normal alignment. So if you have an increased curve, that means your back muscles are doing more work because they're shortening and they're just constantly on tension. If you have the reverse, a complete reversal of that, now those muscles are overstretched and then can become weak or create muscle spasms. And due to the way that we sit and stand and move, oftentimes many people go from one extreme to the other. You go from completely reversing the curve in your lower back to completely hyperextending the curve in your lower back, all depending on if you're sitting or standing. And so this can really wear out your lower back before you even get to exercising. The main muscle group that is supposed to help keep your spine stable, especially while you're moving, are actually your abdominal muscles. So the health of your back is not necessarily determined by the strength of your low back muscles, which of course do play a role, but the stability of your spine is really a measure of how strong your abs are. And they are directly related to, or they have a really close relationship with how flexible and strong your hips are. So for instance, if you're supposed to hinge at your hips for everything. So by hinging at your hips, then your low back doesn't have to flex forward or back for you to get your trunk to come down closer to the ground, to pick things up, to move things around, right? So if you have very tight hips, meaning like hamstrings are tight or your hip flexors are tight, that will directly affect how much you have to use your low back. And like I was mentioning before, when we have to go through those extreme movements in our back, we're inadvertently wearing our back out and making things fatigued and weaker without necessarily realizing it, because it doesn't always cause pain until it's just overdone. So now if I get back to Tom after that anatomy, so he came in and he was having some very acute lower back pain. And so one of the first things I suggested he do when he got home is to lay flat on, it doesn't matter, it could be your bed or the ground, and just be in a comfortable position and put an ice pack on. But like many people, Tom couldn't actually lay flat because it hurt his lower back. So what I told him to do is to use pillows to build up his hips so that he could still be on his stomach and laying down, but without having too much stress on his back. And he was able to find a comfortable position like that and lay ice on top. And what that does is that gives you, ice helps calm down inflammation. So with the overuse muscle that's strained or causing a muscle spasm, by putting ice on it, you help alleviate some of that inflammation. So the next thing I showed him was a few lower back stretches. And I stressed a lot that the idea is not, the stronger the stretch is not necessarily better. You really, really just want to barely feel a stretch, barely be uncomfortable. If you're dealing with low back pain because of a severe muscle spasm and you go cranking into these stretch positions, all you're going to do is cause that muscle to contract even harder, and you'll have more pain and more discomfort. And so I showed him, and we stressed and we practiced how to gently stretch his back. We did try a few stretches to see what would work for Tom. So we tried what they call a single knee to chest. We tried a double knee to chest. We tried lower trunk rotations. And finally, we tried child's pose. All very gentle. You can control how hard you pull. And it really depends on the person, on which ones work best for them. So, and then the rest of the time we looked at hip flexibility, core stability, all these things, all these little parts, because his ultimate goal is to get back to squatting, and he wants to be able to squat more weight than he got himself injured doing. And so we needed to start from where he was and then work on that. And that would be one of my biggest suggestions, is that no matter who you choose to help you resolve your low back pain, if your goal is to get back to lifting a certain weight or getting back to a sport, you need to work with a therapist or either a physical therapist or a movement specialist that is going to take your goal to heart and set up a plan to achieve that. Because just getting Tom out of pain is probably going to take, maybe 3 or 4 sessions to have his pain stop. But that's not when the healing stops, because the idea is that if you injured yourself and now you're just out of pain, are you really strong enough to get back to the sport that you want? Are you really stable enough to get back to doing what you want? And there's lots of research out there that shows that specifically with back injuries, because it is so complicated, it doesn't just take 2 or 3 sessions to heal it completely and to not deal with this problem again. It takes some consistency and a certain level of strength. And strength just takes time to develop. And so that was how we set up our program. We had milestones that we were going to hit, and to help him achieve the goal that he ultimately wanted, which there was a specific weight he was trying to get back to. And so by the time we were done with our program and with everything, Tom was no longer frustrated with the fact that the doctor said there was nothing wrong. He actually understood what that doctor really meant was that there was no structural damage, which is good, right? That's always a good thing. But the muscles really were overworked, and that was something that he and I were able to work on and make it to where he was able to get back to his squatting at the same level before injury. And without any complications. So if this is the type of care that you're looking for, that is fabulous, because that's what I love to help people do. I love to help people get back to their favorite sports. So much so that I even created an online book, an ebook, for how to keep your back from going out more often than you do, because that does seem to be a big problem for people. Lower back pain is a huge issue, and lots of people are dealing with it, and you shouldn't have to deal with it any longer than you already have. So I've put together my best tips. If you're looking for a little bit more information, there'll be a link for that. And if you're having a specific concern, and maybe you really have had therapy and you've tried all these things and you're just wondering what, if anything, I can offer that would be different, I'm going to leave a form. You can fill that form out and let me know a time or a day or a time that's good for you, and I will get back to you. We'll set up a 20-minute call so that you can ask me all the questions. And if we end up being a good fit, maybe we work together. And if not, maybe you get more information on how to get the help that you do need. I hope that everybody's having a great day, and I'll talk to you soon. Bye.